the salary GPs here at Priory Fields surgery. Thank you all for coming and being part of this educational evening. I would also like to thank my practice manager, Lucy, everyone involved in the practice, and all the members of the PPG to make this possible. The main aim of this session is to give you enough information and knowledge about some symptoms that all of us experience on and off, how to recognize it, to understand how to deal with it, and then to understand when to seek medical attention. The first symptom that I will be speaking about is fever. So basically, what is fever? Fever is the body's response to an infection, immune response to an infection or inflammation. The normal body temperature is anywhere between 36 degrees Celsius to 37.2 degrees Celsius. Between 37.3 to 38 degrees Celsius is what we consider low-grade fever, and anything equal to 38 or over 38 degrees Celsius is what we call fever or pyrexia. Now, I want this to be a little interactive. So any guesses on what is the most common cause of fever? Any guesses?
Flu.
Yes. Yes. So basically, virus is the most common cause of any fever. So these are the causes of fever. Most common cause is viral infections, then you have bacterial infections, other infections. You can get fever as a response to vaccinations. A lot of patients say that they had some sort of jab, flu jab, and they spiked their temperature. So many patients said they had COVID vaccines and they spiked the temperature. So it can be a reaction to vaccines. Some medications can make you spike temperature. The thing that we have to be careful about is people who already have some autoimmune diseases, like rheumatoid arthritis, juvenile arthritis, type 1 diabetes, underactive or overactive thyroid. These people are susceptible to contracting fever more frequently compared to other healthy individuals. So we just went through all of these. These are just names of different infections and how you can catch different fevers due to underlying causes. What are the causes of common cold or viral illness? It's something all of us have had. Headache, body aches, joint pains, muscle aches. Depending on what kind of flu or virus it is, either you have a runny nose or you have a congested nose. You can have sore throat. You can have a cough. The cough in viral illness is usually dry. You don't get a wet or a productive cough. You won't have a phlegm. So in bacterial chest infection, you usually get a green or yellowish phlegm, but viral infections, you have a dry cough. Okay? There can also be signs of fatigue, unexplained fatigue, and chills. So a lot of people complain of chills and sweating when they have viral infections. What is the treatment? Very simple. We can all treat viral infections on our own. Rest, hydration, so drink plenty of fluids and water. Depending on how frequently you're spiking and how bad you have joint aches and pains, you can have paracetamol every 4 to 6 hours. You can top it up with another non-steroid anti-inflammatory like ibuprofen. And then symptomatic management. So if you have sore throat, you get over-the-counter lozenges. If you have cough, which is a dry cough but is irritating you, you can have cough syrup over the counter. You can do warm saline gargles, which really helps with sore throat symptoms when you have a viral infection. And all of these treatments are usually done over the counter. You don't actually need medication. The only time you seek medical advice, even though it's a viral infection, is if someone has had persistent fever and the temperature is crossing 39 degrees Celsius, if the person appears confused, and they have very severe headaches, and another, what we call red flag sign, is if they have neck stiffness. So how can you tell if your patient has neck stiffness? Usually all of us should be able to touch our chin to our chest like this, and our ears with our shoulder like this. So if you're unable to do that, that's a sign of neck stiffness. Alright. So this is just a diagram to show you what is considered mild, what is considered severe. Mild is the common cold symptoms that we just discussed. These symptoms usually resolve on their own, you don't have to worry. Severe symptoms are the ones that we discussed: neck stiffness, severe headaches, confusion. If they start developing difficulty in breathing, then these kind of patients need to seek medical advice. And the ones that we need to keep a close eye on are patients who already have underlying autoimmune conditions, like type 1 diabetes, underactive or overactive thyroid, rheumatoid arthritis, any sort of juvenile arthritis. Now, what are the signs of bacterial infection or fever? Similar to virus, but bacterial infection will always have a focus. So it will start with the organ that has the infection. So someone complaining of sore throat only, without headache, runny nose, body aches, joint pains, just the sore throat, it's probably a bacterial source of infection. Someone complaining of cough and it's productive, they're bringing up green yellowish phlegm. Some patients say that they have specks of blood in their phlegm. It's probably a bacterial chest infection. So bacterial infections usually always have a focus. It's not vague like virus, everything is involved. It has a focus of infection. Okay? And then depending on where the infection is, sometimes you can even get swollen lymph nodes around that area. So for example, if someone presents with tonsillitis, the lymph nodes under the chin or this area might be enlarged. What is the treatment of bacterial infection? Similar to virus, but this has to be treated with antibiotics. A lot of patients ask for antibiotics when they have viral illness. Antibiotics only act on bacteria. They have no effect on virus. But for a bacterial infection, we need to treat them with antibiotics. The rest is similar: rest, hydration, over-the-counter pain relief for joint aches, body pains, paracetamol every 4 to 6 hours. You can top it with ibuprofen, which is stronger. Okay, so sepsis is something we should be concerned about because bacterial infection, if not treated on time, can turn into sepsis. And it is very important to treat sepsis within a certain time period because then it can transform into what we call septic shock. So what is sepsis? The definition is here: syndrome defined as a life-threatening organ dysfunction due to a dysregulated host response to infection. Basically, it's an exaggerated response, body response to infection, to a point where your organs are not working properly. Your kidneys shut down, the circulation to your heart starts shutting down, the circulation to your brain starts shutting down. That's why you need to treat it within a certain time limit. Now, a subset of sepsis, which is even more dangerous, is what we call septic shock. So septic shock involves damage at a circulatory level, cellular level, metabolic level. So it has a greater mortality risk than sepsis alone. That's why we treat sepsis as soon as possible. If we identify someone having sepsis at our practice, they're transferred straight to the hospital, and within an hour they get IV fluids, antibiotic, oxygen if required, and the treatment is administered as soon as possible. So this is just a flow chart to show all the different abnormalities septic shock can cause. It causes circulatory problems, so your blood doesn't flow properly. Cellular, even your cells do not function properly. Metabolic, your kidney, your liver doesn't work properly, so the waste that your kidney is meant to excrete, it doesn't do that anymore. The liver is a metabolic organ, it's meant to metabolize drugs, it doesn't do that anymore. Basically everything is shutting down. This is why it is very dangerous if we don't treat septic shock on time. Now the signs of sepsis is what we discussed in bacterial infection, but it's slightly more exaggerated. So severe fever that doesn't really come down. Rapid heartbeat, so the patients say that they can feel their heart pounding, palpitations all the time. Rapid breathing or shallow breathing, so even going from point A to point B, the patients are quite breathless. Confusion, they're very confused. Skin discoloration, this can vary from children to adults. In adults you get molted skin appearance. In children, you can get really red, angry rash, and they're non-blanchable. So if you do a glass test on them, the rash doesn't disappear. Those are the dangerous rashes. Extreme shivering, so they're shivering a lot. Some patients, they shiver so much that it mimics like a seizure, but they're not actually having a seizure. Their body's response to the infection is so much that they're shivering. And then other signs are just lightheadedness, tiredness. They might get vomiting, diarrhea, they're confused. Okay, now the next topic, the next symptom is sore throat. Okay, So similar to bacterial and the other infections that we discussed, the most common causes of sore throat is virus. Then you have bacterial cause, and the other causes can be environmental, smoking, and then irritants. So some patients, they work in environments where they're exposed to dust. They're in the construction business, so they're exposed to constant chemicals, dust entering their mouth that can lead to sore throat. So when would you say someone has bacterial sore throat? Anyone can just shout out. When would you say that someone's sore throat is related to bacteria as opposed to all the other symptoms or causes?
Yes, swollen.
Yes, so the lymph nodes will be swollen and there will be a specific focus of infection. So it's like the picture here. Can you see the picture here? There are specific pus points on the tonsils. There will be a specific focus of infection if it's a bacterial sore throat. And the patient will have high fever, and like Amy said, swollen tonsils and swollen glands, and some patients will even have rash accompanying sore throat. Okay.
It's difficult to eat or
swallow, yes. Okay. Now it's the last topic we'll be discussing, but it's very important, it's hypertension. So basically, blood pressure is just a measure of how much blood is being pushed against the walls of your arteries. If the force is too much and uncontrolled, it leads to hypertension. Okay? So the normal blood pressure for adults should be equal to 120 by 80. 120 is the upper limit, what we call systolic blood pressure, and 80 is the diastolic blood pressure, the lower limit. So if the person's blood pressure is between 140 by 90 and 180 over 120, what do we do? There are two ways of assessing these patients. We either offer them an ambulatory blood pressure monitoring, or what is very popular here is a home blood pressure monitoring. Ambulatory is a little bit cumbersome because it requires the patient to do measurements, 2 measurements per hour, their entire waking hours in the day. So suppose someone wakes up at 8 a.m. and sleeps at 10 p.m. They're meant to do a blood pressure every hour and do 2 measurements, 2 readings. So a lot of patients either forget or they work and they're not able to do it. The simpler one that we offer is the home blood pressure monitoring, where you do your blood pressure twice a day, morning and evening. To make it simple, sometimes we tell patients do 9 a.m., 9 p.m., 8 a.m., 8 p.m. And then do it for a week and then just drop the readings here and we calculate the average. While waiting for the blood pressure average, what do? Do we just leave these patients? No. So we assess them for what we call target organ damage. If you have blood pressure, it can affect every organ in your body. So we do blood tests. And we usually focus on the kidneys because kidneys are the first organs to be affected if you have blood pressure. And we do an ECG. Now, patients who come, who have never had blood pressure before, and they come with a blood pressure of 180 by 120. If they are symptomatic, meaning if they have severe headaches, we do an ophthalmoscope examination and we see hemorrhages at the back of their eye. They're showing signs of chest pain, heart failure. The signs of heart failure is that they can't breathe properly, they're swelling in both their legs, and they're very, very short of breath. If they're showing signs of that, and if they're showing signs of acute kidney injury, meaning they're not able to pass urine properly, then we send them to the hospital the same day. But if someone comes and they have a blood pressure of 180 over 120, they're already on blood pressure tablets, and they don't have any of the above symptoms, we tell them to repeat the blood pressure in a week's time, but we keep an eye on them. Okay? So this is just for information. Stage 1 hypertension is when the clinic blood pressure, the one that you do here at the surgery, is between 140 over 90 to 159 over 99. And if the home average blood pressure is between 135 over 85 to 149 over 94. Stage 2 is if the systolic blood pressure is higher. So 160 over 100, but less than 180 over 120. and if their average of a week comes back equal to or higher than 150/95. And stage 3 is if they have 180/120 of blood pressure. Okay, so what do we do to patients who have high blood pressure? Obviously, we treat them. We do investigations to make sure that their organs are not damaged, heart, kidney, liver, all the blood tests. But we also offer lifestyle advice. So diet and exercise, they need a healthy diet, less junk food, less salt in their diet, less preservative food. They need to have more fruits and vegetables in their diet. They need to be more active, so they need to do more exercise. If they're on the overweight side, we request them to lose some weight because that can add additional stress to the arteries. Smoking and alcohol. And we also advise them to reduce the amount of caffeine intake, whether it's energy drinks, numerous teas and cups of coffee during the day. It really affects your blood pressure and it affects your sleep. And if you don't sleep well, then your blood pressure increases in the morning. So this is a very nice diagram. It's basically a step-ladder pattern showing how we manage blood pressure in the community. Step 1 is it's just an initial assessment. Someone's come with a one-off blood pressure. Step 2 is we just don't ignore that. We offer home blood pressure monitoring. And while the patient is doing that and we're awaiting results, we do blood tests to make sure that the patient doesn't have any target organ damage. And then lifestyle advice like the ones we just said, cut any alcohol, cut caffeine, smoking, improve their diet, exercise. And then treatment decisions again. This is going into the technical bits, but basically NICE CPS has a flow chart on how to treat blood pressure for under 55 and over 55, and if they're diabetic or they're not diabetic. So depending on these factors, we start them either on what we call ACE inhibitors or calcium channel blockers. And if it's not controlled by one drug, then we do a combination of different drugs until we get it down to target. And the last is just monitoring. So we don't leave these patients. Patients who are on ACE inhibitors, they need their kidney functions to be checked every now and then. So we make sure that they're not being affected by the side effects of the medications that we've started. So that's part of our ongoing management.
Aisha, can I ask a question?
Yes.
How easy is it for people to bring their blood pressure down through sort of lifestyle choices rather than medication? Is it quite easy to do?
So it depends. So if there are multiple factors involved, like if the patient is very obese, is diabetic, has high cholesterol, lipids are all over the place, has bad lifestyle choices, smoking a lot of alcohol, then doing everything at once can be quite daunting for that patient. So we tend to target the main things. So in the example that I gave, we would target the blood sugars and the blood pressure, and probably the cholesterol. So even if the patient doesn't have a healthy diet and is still smoking and drinking, we would still focus on the blood sugar, so the diabetes side of things. And we'll try to give them a statin to bring the cholesterol down, because these are the 3 bad ingredients of getting a heart attack or strain on the heart. So we would ignore the rest, but we would focus on the main. So if it's a young adult in his 30s or 40s who doesn't have diabetes and the other comorbidities, but just has bad lifestyle choices, then we would try to focus more on the lifestyle choices. Yes. And that will come down. So the last thing is the red flag signs of hypertension. This is also very important. What are the red flag signs of hypertension? So if someone already has high blood pressure but they're having severe headaches, they have visual symptoms where they see double vision or their vision is now blurred. If they're having difficulty breathing, very common symptom is nosebleeds. A lot of patients come with nosebleeds, and the first thing we do is check their blood pressure. So that can be sign of epistaxis or nosebleeds can be signs of high blood pressure. Signs of heart failure, like when they sleep flat, they're not able to do it anymore. They have to use 2 pillows. And their legs are swollen, and if they walk from point A to point B, they're huffing and puffing because they're short of breath. That just means there's fluid in their lungs. So that's signs of heart failure. That is a complication of high blood pressure. Signs of kidney disease, they're not passing enough urine. That's another sign of complication of high blood pressure. And then you can get neurological deficits like confusion. The most dangerous part of having high blood pressure is getting stroke and heart attack. So stroke-like symptoms. So if there's drooping of the angle of the mouth, if there's weakness on one side of the body, or arms and legs, or even the face, that is basically pointing towards stroke-like symptoms due to high blood pressure. So these patients are transferred to the hospital as soon as possible.
And that's it. Amazing. Thank you very much.